Hi, welcome to another episode of Talking with Docs. I am Dr. Paul Zalzal.
And I'm Dr. Brad Weening.
And we have
Andrea, I'm the physio.
Thank you very much, Andrea, for
Thanks,
this video that we're about to make. And the video is about how to get in and out of bed after you've had a hip replacement or a knee replacement.
Right.
I think the first thing you should do is reconsider some of your life choices if this is your bed. There are no sheets, there's no comforter, there's no pillow. So that would be the first thing that I would advise you to do.
Sure enough.
Okay.
Okay, so after having a hip replacement, you'll be on hip precautions for 6 weeks. So getting in and out of bed can sometimes be a little difficult. So there's a few tools that you can use to assist. This is called a leg lifter. You can hook it under your foot. If you have a cane at home, you can hook the cane under your foot. Or if you don't have either, you can grab a bed sheet and actually wrap it around your foot and just hold it up top. So because you can't bend past 90 degrees here, you might dislocate. You'll have to keep yourself flat in bed and keep your knee straight. So we'll do it with the cane this time. So you'd wrap the cane around the bottom of your foot, grab on, and just pull out. Careful not to sit up too quickly so that you go past that 90 degrees, and then out you go. Some people like to cross their legs to help assist that leg out of bed. With a total hip replacement, you can't do that because as part of the hip precautions, you're not allowed to cross your legs. So that is not an option for getting out of bed. And the same thing would go for getting back into bed. You can put the cane or the leg lifter underneath and help assist it back into bed.
Okay, can we demo it one more time then?
Yes, for sure.
Okay, so this is with the hip replacement, how to get out of bed.
So I'm like, try to call my wife, and she's like, get yourself out of bed.
Okay.
So I'm like, okay, so I lift my leg up, and then I swing around. And then this is because the muscles of your hip are too sore
Yep.
to hold my leg up on its own. Eventually you'll be able to do it just with your own leg.
Another tip we give is you can put a plastic bag or a garbage bag at the bottom of your bed so it makes it slide easier, so you can even avoid using one of these two items, and you can just try to slide it to the end of the bed and it'll come out a little easier.
Seems pretty straightforward.
Okay, so that's how to get out of bed after you've had a total hip replacement. What about how to get out of bed after you've had a total knee replacement?
So after a total knee, you can do the same as we just did, but you also have the option of hooking your unoperated leg underneath your operated leg and use it to lift, and then you can guide it out of the bed, and you don't have to worry about any hip precautions because you don't have any.
Right, and primarily you're probably going to be trying to keep your leg straight because it hurts more than anything.
Right.
So
You want to have something to control the knee descending down to the floor. You don't want it to just drop down because it's going to hurt. So that way you can have the leg underneath and it'll help with that.
and then same thing on the way
Same
up. You
thing
just
to get
kind of
back
hook
in.
it
Yep.
and then lift your legs around. And I think like we had talked about one of our other videos, if you try this ahead of time before you have a freshly operated hip or knee, I think it'll prepare you for learning it. So there are so many new things after you get your joint replaced. That's why I tell people, do the prehab, learn the exercise so you can focus on just getting better and not trying to learn a bunch of new stuff.
Okay, there you have it. That's how to get out of bed after a hip or a knee replacement. Please leave us some comments if you have any feedback on this video. Please check out our other videos on how to prepare for a hip replacement or knee replacement. And we even have a video that shows the actual knee replacement.
Thanks again to Andrea for joining us and demonstrating. And if you like this, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.